pancreatic cancer, it's just devastating. Aggressive, often caught late, and we lost, over 50,000 lives just last year in 2024 alone? It's really rough.
It is. It really is.
But, it's not all doom and gloom. There's actually some pretty exciting news coming out of Oregon Health and Science University.
Oh, yeah?
Yeah. Researchers there might have just turned the tide, really changed things, with a groundbreaking new blood test. They're calling it Pac-Mann?
Pac-Mann.
Yep, Pac-Mann. And get this, early data suggests it can detect pancreatic cancer with like an 85% accuracy rate.
Wow, 85%. That's incredible, especially considering how often pancreatic cancer is diagnosed in the later stages. This could be huge.
Right. Okay, so I know you're probably like, wait, what? Tell me more.
Yeah. What is this Pac-Mann all about?
Okay, so let's break it down. First off, this thing is fast.
Fast.
Pac-Mann can give you results in, get this, 45 minutes.
45 minutes? No way.
Yeah, 45 minutes. Think about that. Instead of waiting weeks, agonizing over results, patients could have answers almost immediately. That's insane. And they can start treatment plans right away, too.
Exactly. And it's not just speed, it's minimally invasive, too. Pac-Mann needs a tiny amount of blood, like 8 microliters.
8 microliters, how much is that even?
It's less than a drop.
Yeah.
Seriously.
Yeah.
Way less invasive than the usual methods.
Okay, less invasive, faster results. This is sounding good. But how does it even work? Like, what's the science behind it?
So Pac-Mann stands for, get ready for it, Protease-ACtivated MAgnetic NaNosensor.
Protease-activated, huh? Okay.
Basically, it uses these magnetic nanoparticles. They're linked to fluorescent molecules, and they use that combo to detect specific proteins in your blood called proteases.
Proteases, got it. So these proteases, they like little messengers or something.
Yeah, you can think of them like that. They give us clues about what's happening in the body.
Interesting.
And with a specific type of pancreatic cancer, pancreatic ductal adenocarcinoma, or PDAC for short, these proteases, they become way more active.
PDAC. Right, so the test is looking for that increased activity. You got it, like a radar zeroing in on those telltale signs of cancer.
Makes sense. So we got fast, minimally invasive, and accurate. What else?
Oh, it's also super cost-effective. The researchers say it costs less than a penny per sample. A penny.
A penny. Seriously. That changes everything. Think about what that means for global healthcare.
Right. Screening could become accessible to so many more people, especially in areas that, don't have a lot of resources.
Absolutely. Early detection, especially for pancreatic cancer, is key, right? Early intervention can make all the difference. This could really change how we approach screening and diagnosis, like everywhere.
This all sounds almost too good to be true. So is this like theoretical, or have they actually tested this thing out?
Oh, no, it's been clinically tested. They did a study, 178 participants, and the test got it right, like nailed it, for 40 out of 55 people who actually had pancreatic cancer. And then 120 out of 123 people without the disease, it correctly said they were fine.
So the research is there. Solid research backing up these claims. Pretty impressive. But I'm curious, how does this Pac-Mann stack up against the CA19-9 test, the one they're already using for pancreatic cancer?
That's a good question. You see, the CA19-9, it can be helpful, but sometimes it's a little, I guess you could say, overzealous. It'll say there's cancer even when there isn't any.
False positives.
Yeah, exactly. And those false positives can lead to unnecessary anxiety, extra procedures, all that.
Right. So that's a problem with the CA19-9. Does Pac-Mann have that same problem?
Well, no test is perfect, obviously, but the way they designed Pac-Mann, it's very precise. In those clinical studies I mentioned, it showed a specificity of 98%.
98%? Wow, that's high. So way lower chance of a false positive than with CA19-9, right?
That's the idea, and that's why the researchers think that using both Pac-Mann and the CA19-9 together, that could really boost our ability to catch pancreatic cancer early.
So it's not about replacing the old test, it's more like adding a powerful new tool to the toolbox.
Exactly. It's all about giving doctors, clinicians, the best possible information, right?
Yeah.
So they can make the best decisions for their patients.
And hopefully giving those patients a real fighting chance. Pancreatic cancer has always been one of the toughest to treat, so this could be a real turning point.
Yeah, it's a big step in the right direction. There's a lot of excitement about this, about what Pac-Mann could do. But got to remember, it's still early days. Still research going on.
Right. Definitely promising, but still early. So where do they go from here? What are the next steps for Pac-Mann?
Well, the team, they're planning more trials, focusing on high-risk folks this time. They want to see how Pac-Mann works in real-world situations, outside the controlled environment of a study.
That makes sense. High-risk groups, think about the peace of mind this could offer, especially for those with a family history of pancreatic cancer or maybe some genetic predisposition.
Exactly. Early detection could be life-changing for those individuals.
Yeah.
And that's what makes this whole thing so important, right? It's not just about numbers and data. It's about real people. It's about maybe even saving lives.
Yeah.
It really is amazing when you think about the potential, especially for those high-risk individuals.
Oh, yeah, absolutely. Imagine, someone with a family history of pancreatic cancer, or maybe they have certain genetic predispositions. The peace of mind this test could give them, it'd be huge.
Huge, yeah. Early detection, it really changes the game, opens up so many more options.
Makes sense. Early stages, treatments are usually less invasive, more effective, all of that. But, okay, we've talked a lot about what this test does, but how about we dive a little deeper into how it actually works?
Sure, happy to. So we've mentioned these proteases a few times, right?
Right, those proteins.
Yeah, so proteases, they're involved in all sorts of things in the body, normal functions. But there are certain types that go kind of haywire, become way more active when pancreatic cancer is present.
Got it. So it's not just that the proteases are there, it's that their activity level spikes, like a warning signal.
Exactly, a strong signal. And that's what Pac-Mann is designed to pick up on. See, the magnetic nanoparticles in the test, they're coated with these fluorescent molecules. And when they bump into those overactive proteases, well, the proteases basically snip those fluorescent molecules right off.
So the proteases are like tiny little scissors cutting away those fluorescent markers.
Perfect analogy. And the more snipping they do, the stronger the signal gets. And because the nanoparticles are magnetic, we can collect them easily, analyze them, and the amount of fluorescence that's been released, well, that tells us how much protease activity is going on.
So more fluorescence, more protease activity, higher chance of pancreatic cancer. Pretty elegant. But I'm guessing there are some challenges, right? I mean, no test is perfect.
Of course, of course. And one of the big ones with any diagnostic tool is those false positives, right?
Right. Like we talked about with the CA19-9, sometimes it cries wolf when there's no wolf. Is that something to worry about with Pac-Mann too?
It's a possibility, always. But the researchers have really tried to minimize that risk. Pac-Mann is very specific to pancreatic cancer, and those clinical studies, remember, showed a specificity of 98%.
98%, that's reassuring. So pretty low odds of a false positive then.
That's what the data is showing. Of course, more research will help solidify those numbers, see how it performs in different groups of people.
Right, makes sense. And those trials, especially the ones they're planning for high-risk individuals, those will be really important. Speaking of which, let's zoom out for a second. Think about the bigger picture. Say Pac-Mann does become widely available. What does that mean for our healthcare systems?
Well, it could be a game changer, that's for sure. Widespread screening for pancreatic cancer, it's a big deal. But we need to make some changes to our healthcare infrastructure. Make sure there are enough places to do the testing, train healthcare professionals on how to give the test and how to interpret the results, and then figure out core guidelines, who should be screened, how often, all of that.
Sounds like a lot of work.
It is, no doubt. But any big medical advancement, it comes with its own set of challenges. And we need to be proactive about addressing those challenges. Like, think about access, right? Making sure everyone can get the test, no matter where they live, what kind of insurance they have, all of that.
Equity, yeah, that's huge. This test, it needs to be available to everyone who needs it.
Absolutely. We've got to think about strategies to address those disparities. And then there's the support side of things. People who get a positive result, they're going to need support, counseling, resources to help them figure out what comes next.
The human side of things, yeah, it's a big deal. Even if the cancer is caught early, it's still a life-changing diagnosis. How do we help doctors, nurses, everyone involved have those tough conversations with patients?
It's not just about the technology, it's about the people, right? Compassion, empathy, remembering that a diagnosis like this, it goes beyond just the medical stuff.
Powerful reminder, for sure.
It really is. This whole thing, Pac-Mann, it's incredible, a real leap forward. But it also makes us think about the bigger picture, the responsibilities that come with a tool like this.
We've talked a lot about the good stuff, the benefits, but are there any downsides, anything people should be cautious about?
That's a great question. One thing that comes up is the risk of overdiagnosis.
Overdiagnosis? What does that mean?
It's like, imagine finding cancers that would never have actually caused any problems, never become life-threatening, and then, because we found them, people might end up getting treatments they don't really need, could do more harm than good, you know?
So it's a balancing act, I guess. Finding things early is good, but we don't want to go overboard.
Exactly. That's why those further trials are so important. Get more data. Figure out how to use Pac-Man the right way. Find that sweet spot between catching things early and avoiding unnecessary treatment.
It's complicated for sure. Each patient is different, different risks, different needs.
Absolutely. Open communication between patients and their doctors, that's key. Talking about individual circumstances, risk factors, all of that.
So Pac-Man, it's amazing, don't get me wrong, but it's not a magic bullet. It's a tool that needs to be used carefully, thoughtfully, along with all the other diagnostic tools and the doctor's expertise.
That's it. That's the key. Personalized care, giving patients the information they need to make the best decisions for themselves.
We're almost at the end of this part of our deep dive into Pac-Man, but it feels like we're just getting started, you know? So much more to explore, so much more to talk about.
I agree. It really makes you think. All these big questions about science, about healthcare, about what it even means to be human.
It's really kind of mind-blowing when you think about it. I mean, medical diagnostics, it's changing so fast. We could be looking at a future where a test like Pac-Man, it's just routine, like get your cholesterol checked, get your Pac-Man test, that kind of thing.
Yeah, it really puts things in perspective. The progress we're making in the fight against cancer, it's incredible. Immunotherapy, targeted therapies, personalized medicine, all of it.
Yeah.
Feels like we're right on the edge of something big, you know?
Absolutely. It's exciting. Definitely a lot of reasons to be optimistic. But, you know, got to bring it back to Pac-Man for a bit. We've talked about the science, the good stuff, the challenges, all of that. But what about the people going through this? What are patients saying, their families? What's their take on this whole thing?
Well, from what I've seen, the response has been really positive. I mean, for people who've dealt with pancreatic cancer, either themselves or someone they love, Pac-Man, it's like a light at the end of the tunnel, you know? Being able to catch this thing early, maybe even before you have symptoms, that's huge. It gives people a sense of control, a sense of hope.
Yeah, it's not just about the technology. It's about what that technology represents, that hope. It can really make a difference.
Totally agree. Hope can be a powerful motivator, right? It can encourage people to get screened, take charge of their health, and even approach treatment with a more positive attitude.
It's true. Sometimes we forget that. Science, it's not just about data and numbers. It's about people, about making their lives better, giving them a chance.
Couldn't have said it better myself. Pac-Man, it's really a testament to what we can do, you know? Human ingenuity, finding solutions even when things look really tough.
We've touched on the societal impact, screening a lot of people, all of that. But what about access? How do we make sure everyone who needs this test can actually get it?
That's the million-dollar question. Equitable access, we got to figure that out. Cost is a big part of it, of course. But there are other hurdles, too. You know, where you live, what kind of insurance you have. Sometimes people just aren't even aware of the options.
So it's more than just making the test cheap. It's about making sure everyone has a shot at getting it, no matter their situation, right?
Exactly. We need a multi-pronged approach. Strategies that take all these factors into account. Make sure everyone has a fair chance at early detection, at getting the treatment they need.
Big challenge for sure, but definitely one worth tackling.
Without a doubt. And it's going to take all of us working together, researchers, doctors, policymakers, even patient advocacy groups, everyone.
A team effort for sure. And it really highlights something important, I think. Scientific progress, it's not just about inventing new things. It's about using those things wisely, responsibly, thinking about the ethics, making the world a better place, a healthier place.
Well said. Knowledge, resources, all of it. Using it to make a real difference in people's lives, that's what it's all about.
Well, this has been a fascinating deep dive into Pac-Man. It really does feel like we're on the verge of something big here, potentially a whole new way of dealing with pancreatic cancer. But as we've been talking about, there are other things to consider. Access, ethics, the future of healthcare, all of that.
I agree. Lots to think about, lots to discuss. It's an exciting time, but also a time to be careful, to be thoughtful.
We hope this deep dive has given you a better understanding of Pac-Man, of what it could mean for the future. Keep learning, keep talking about this stuff. It's important. Knowledge is power, right? And the more we know, the more we can all contribute to a healthier future.